Okay, you guys, well, it's 8:02, so we might as well get started. I'm Dr. Maureen Hayes from Galveston, Texas, obviously formerly from Atlanta, since we're talking about that. And I'm joined by Dr. Lee Ostler, dentist extraordinaire and incredible author from the state of Washington. As you guys know, he runs Redox Matters, the books and the website. You can order his books there. You're on number 4 or 5 now. How many is there?
We're working on 4.
Working on 4, amazing, just prolific writer, and his books are gems. So go there, and you can also see the archives and the recordings of previous episodes of the Redox 5. So they're always great. And tonight we have a fan favorite on, Dr. Aaron Kaufman from New Mexico. People love to hear him. We love him because, number one, like Lee and myself, he's one of the members of the medical professional board with the SIA. So we're all big friends, and he is also still practicing. He has an integrated practice. He's been practicing that for years. He's a board certified family practitioner and just brings an incredible level of wisdom and knowledge to this. And we love that, having been previously cynical about it, he's now using it. And we'll have him talk a little bit about using it in his practice, because I don't think we talk enough about that. We have a lot of practitioners who are trying to figure out how to incorporate it, and Dr. Kaufman can help us with that. But we thought we'd start a little bit. Number one, Dr. Kaufman, would you mind telling people what it is we're talking about here and maybe giving our disclaimer?
So redox signaling molecules, which are the components of ASEA redox or ASEA and the Renew 28 gel, are cell signaling molecules. And this is a relatively new science. We didn't really understand this until about 1998, when these 3 Italian researchers, PhDs, won the Nobel Prize for showing what all of us, Dr. Ostler and Dr. Hayes and I, when we were in medical school and dental school, and we're studying Krebs cycle, energy production inside the little energy factories in every cell, the mitochondria, we thought they were waste products. And we didn't think twice about them. And in 1998, these 3 researchers won the Nobel Prize for proving they were not waste products. They literally turn on and turn off, or signal, every single process in every living cell. So you guys don't hear us speaking. You don't think a thought. You don't grow hair. You don't digest food. You don't take a breath. Your heart doesn't beat. That's not turned on and turned off or signaled by these molecules. And interestingly, when we're little children, we have tons of these. Starting at puberty, every year we make less and less and less. So you think about a little kid, 5 or 10 years old, they cut or burn themselves or sprain their ankle. In 2-3 days, they're fine, right? So by the time we're 30, again, less and less every year, that same cut or burn or sprain is probably going to take 2 or 3 weeks to heal. I'm in great shape. I'm an athlete still at age 70. But if I cut or burn myself or sprain my ankle, it's probably going to take 2 to 3 weeks, or months to heal, excuse me. So the way to think about what these products are and what redox signaling is they are the molecules of youth. So aging, a real important concept, aging is a deficiency of these cell signaling molecules. And the ASEA Corporation in Pleasant Grove, Utah, is the only company in the world, the only people in the world that had figured out, number one, pretty miraculous, how to create these exact same reductants and oxidants that we're producing inside our cells. But the real miracle is they're in a stable form. So in an unopened bottle of the ASEA Redox, these molecules are stable for up to almost 2 years. In fact, they're working on research that Dr. Hayes and Dr. Ostler and I are sort of privy to that is making them more powerful, more concentrated, and longer lived. So that's, when I first heard that, it's like, okay, so what? These, again, in our mitochondria, we are constantly producing these with enzymes in nanoseconds. and we consume them. They're utilized in million microseconds. So literally, these molecules are here and gone before you can blink. And again, they turn on and turn off everything. Without them, you don't live. You're not alive. In in an unopened bottle for this to last 2 years, these are the most bioactive molecules in existence. It's like having hot water, boiling water, and ice cubes in the same bottle, and they don't denature. So that's sort of the overview. And I'm sure we're going to talk a lot more. The things that all of us have seen who've been using this, I've been using it 11 years personally and in my practice, are nothing short of miraculous. I see things every day that you just don't see. So that's kind of the long, short version of it.
No, I loved it. I think that was perfect. And, let's just give a disclaimer real quick because we have doctors here and we start talking in jargon very quickly. But this is not a medical product. It's not a medical company. It's not meant to cure, prevent, treat anything. What it is like Dr. Kaufman was saying, when you supplement it, it's a bioreplenishment agent. These little molecules in here are identical to the molecules that are made in our cells. So like he was saying, we have a deficiency. That's why we see the signs of aging. When we replenish it, then our cells act like they're much younger. They do their job properly. So we're making them younger, we're making them sexier. So there. So
Oh, wow.
people say our products, our company's not sexy enough. We're making sexy cells. Get out there,
Dr. Hayes' latest ad campaign. I like it. That's good. Yeah.
You need sexy cells. You need young
Right.
cells.
Right.
So anyway, we were talking a little bit about the science. And of course, we've always, Dr. Lee is our resident expert on NRF2 pathways and keep the key proteins that hold it in the cytoplasm. Why don't you speak a little bit, because Dr. Kaufman was referring to some of the research that has just recently come out and some of the things that the company is working on that we have a little bit of privilege to know about as members of the medical board. Now, we have to be careful about what we say because, hey, people like that sexy stuff. Thank you, Vera. We have to be careful because we do sign non-disclosure agreements. So we get a little excited about stuff. So, we may be like, hey, don't talk about that. But we're going to share some stuff because it's really, really exciting what our company is doing and where it is going with some of the different research that we're involved in. I think we're in 10 different universities. Is that correct? 10 different universities across the world doing different studies. Great. So
More,
Lee,
more and more all the time, more in the wings.
hey, I had somebody just approach me recently that works with my husband that, they're working on some pretty amazing stem cell research and they want to incorporate Redox with it. And I was like, by all means, I'll get some product to you and you can, see how it potentiates what you're already doing. I think that'd be incredibly exciting. So more and more people are learning about Redox. There's more centers, at universities now. So we're ahead of the curve. We know about something and we're taking it every day. Like you, Aaron, I've been in for 11 years. Lee, you've been in for how many years now? 5?
About 4.5 or something like that.
4.5? Yeah. So pretty amazing,
I think it's germane, Maureen, that when you and I started in the first how many ever years, probably 10 plus years of the company, all of the research, nobody understood this. And, Alan Noble loves to talk about going from, when we're ignorant about something, we put it down and then we argue about it and finally we accept it, and it takes a long time. So the research early on was all independent research, well done and pure, that sort of thing, but double-blind, placebo-controlled, all that kind of stuff, but it was independent. And
and
university,
on athletes,
yeah.
initially. on athletes.
Amazing stuff, amazing research. I still love that stuff. That's why I'm here, because we're medical scientists, and that's what sort of fluffed my pillow. But now it's like people are going, you don't really have this, do you? And then they do their studies, And it shows that we have done what they considered impossible, which is to stabilize these molecules like we just talked about. So now universities around the world are coming to us to study this. So I think that's a salient point. And, I don't know if
It's huge. It's really huge because I used to have people, that would put down our research because it was funded by us. And I was like, well, in the beginning, we were the ones asking the questions. Our company was the one asking the questions. Other people didn't even know what we had. So it
Right.
wasn't, independent universities weren't going to come up. Now, the deal that they had with Dr. Neiman, which was some of the original studies, Dr. Neiman, who probably still does run the Human Performance Lab at Appalachian State, he would only agree to do the studies if he could publish the results, good or bad. And they were like, have at it. We're just trying to figure it out. And the results were amazing. So, that's what I saw. That's what got my attention when I first got started too, was his studies, because I was trying to help my husband, who was an athlete. And I thought if it helped those athletes run further, faster, longer, maybe it would do something for my husband. So Lee, why don't you jump in here and tell a little bit about the NRF2 and all the new findings there, because they're exciting.
Well, this is always an exciting discussion for me because it validates, it justifies and puts a floor under this conversation. I was thinking as Dr. Aaron was talking there, I don't think in fact, I know we, meaning the company, did not understand what they had when they started. We're still figuring out what the capability of this technology is, and how far-reaching it is in terms of cellular health. And that's why I want to come back and get into this maybe later, Aaron, is clinically, we live in a world of clinical medicine and healthcare where we use a lot of pharmaceuticals to suppress symptoms, thinking that we're treating something. But the whole point of this, we talk about redox, and that's a word that's made up of the words reduction, oxidation. We're really talking about how electrons move. And when Aaron said these are made in the cell, these are made in the mitochondria. That's precisely what happens natively inside us. That's why these are bioidentical. When we metabolize or combust glucose, part of that process is creating reactive molecules that, again, to repeat, we always thought were bad, universally bad. And so everybody was taking antioxidants to try and put out the free radical fires before they could do damage to cell membranes and DNA and so forth. And for 4 or 5 decades, that's been kind of the whole thing of healthcare is antioxidant action there. But as it turns out, nature doesn't waste much, and it uses these reactive molecules that are created as we metabolize glucose. It actually uses those to upregulate our cell defenses. This is what challenges us to be stronger. It's called a stress adaptive response. And we're not really looking to always be in balance or homeostasis. It's more the nuance of the ability to return to balance once it's been challenged. And so the whole point of cellular health is how can you condition, how can you prepare cells so that when they are challenged, they will stay healthy, or they will respond in a better way to whatever challenges they experience. And that's what we have here is in these molecules. This is nature's way of upregulating, or we talk about switches, cellular switches. They're called redox switches. I mean, and actually for the healthcare professionals and biologists in the crowd, they're called transcription factors. Anytime a protein is made in a cell, it has to be first, the DNA code has to be copied or transcribed, and then it can be made into a protein, in this case, glutathione and other, internal antioxidants. But in turning that switch on, it requires these molecules. That's why this is such an important conversation, because this is moving upstream in all of these pathway genes to be able to upregulate our DNA's response to stress that we have in our environment and just from daily living. So that's kind of probably as deep as we need to go, here. That might have people's ears wondering what's going on, but Aaron, lighten it up for us.
So I'm thinking, Lee. I interviewed Dr. Osler a couple of months ago, and he touched on something that I have been interested in for years and didn't understand. His bailiwick, his area. He's a founding, dentist in the area of oral systemic health, and I am just starting to delve into it as a result of this interview I did with him for dentists and so forth. So, what's exciting to me, we were all three of us being on SIA's Medical Professionals Board just at a meeting a few weeks ago. And I've been on about 3 years or so, I can't remember. It was the most exciting meeting I've ever attended. And apropos of this research, there's more universities coming on board. I think it's privy information at this point, so we won't go into the details. But not only are they going to more universities and more people are asking us to do research, but they're asking from within. And I don't know if it's, you're able to talk about it at all, Lee, but Lee is, pioneering some research that's pretty exciting in that area of oral systemic health. To me, that's very, very exciting stuff.
Well, the foundation for that is, in terms of oral health, is we've known for decades or longer that oral bacteria, is a causative agent for oral disease, periodontal disease, tooth decay, and so forth. And so probably at a level of, I'm going to say 98%, because nothing's ever 100 or 0, but, at probably a high 90% level, everything in this profession has been focused, as far as the science is on getting rid of bacteria by any means possible. And very little attention has been given to what we call the host side, the cell side, our host, our native cell side. And so the question there is, again, it kind of goes back and echoes what we were just talking about, is what is the capacity or capability of my own cells in my body, or in this case in my mouth, to resist the stresses that are put upon it by whatever, bacteria or chemicals or radiation or whatever it might be. And so in this case, we just have to realize that, health is a dual side. You need to remove some of the causative agents. It's just not, wise to expose yourself to, toxic or infectious insults. But at the same time, we're looking at the host side, the host cell side, and asking the question, can we precondition the cell's defensive stature such that it is able to resist or more adequately respond to those threats? And that kind of goes back to what we were saying a moment ago. It's like, how does a cell, any cell in the body, know that it's in trouble? It has to somehow sense or detect or identify that it's having a problem. And then it has to have a response to that. And then once there is a response to that, it has to turn the response off after it corrects the problem. That's the way our bodies are built. And the problem that we have with only relying on what we call exogenous, supplementation of antioxidants, which is all we've had for 40, 50 years, right? But relying on that, even to the point of, we'll call it mega dosing, it's like the more the better, right? What that actually does is it in mega large doses, it suppresses my body's ability to identify a problem and respond to it and turn the response off once I don't need it anymore. And that's really at the heart of this. That's what's so magic about this, is because this is a stress adaptive, stress responsive, preconditioned. We're on purpose with reactive signaling molecules. We're actively challenging the cell just like we do in lifestyle things like exercise and fasting and keto eating and stuff. That's a challenge that produces a little bit of a stress in the body, to which we respond in a heightened, enhanced ability to respond to the stresses that we go, so that we are now hardened. We're ready to recover quicker, right? And that's the whole healing mechanism. We could go on for 3 hours on just that one little aspect of this, but that's the essence of ASEA's redox signaling molecules. Flip switches. They turn switches on and off and precondition or strengthen the cell's ability to withstand or respond to the stresses of life. And there isn't anything else out that can do that in the way that we can do that.
It's really interesting. Somebody was talking about in the chat, asked about people with mitochondrial disease, and we know the biggest thing that affects the mitochondria is aging. We lose 10% per decade after puberty, but our mitochondria are also very sensitive to toxins in the environment, in our food, drink, electromagnetic fields, things like that. A big cause of mitochondrial dysfunction is antibiotics. Certain antibiotics really wreak havoc. And, it's funny when we talk about this, it's almost like we're bypassing the mitochondria. But some of the things that you were just talking about, Dr. Lee, that stress the body, like fasting or high intensity interval training, different things like that, where you're really pushing the body and the body responds, also increases your mitochondria. It increases human growth hormone, increases mitochondrial biogenesis. And so we've never looked, but here's another study we can do. It'd be interesting to see if it affects the number of mitochondria, not just what we're doing with energy and, bypassing and, improving the amount of these signaling molecules we have, but if it actually affected the mitochondria themselves. It'd be pretty cool to find that out.
That would be a great thing to tell Dr. Borges about, to tack on to the study. We can't go into it, but the one that had to do with athletics.
Well, the thing about this whole science, it's a subtitle of my first book. It's about connecting the dots. There's tens and tens of thousands of articles out there that talk about the cell science, the rules of the cell, how cells work. And when you know how the cells work, it's like physics, gravity, electromagnetism, electrostatic forces. It's like they always work. They are never, those laws are never violated, right? And so inside the cell, it's the same way. Once you know how those pathways work, then the question can be formulated: well, what else can we do that will stimulate the cells in those ways? Because it's the outcome that we're looking for, the enhanced cell signaling.
I'm sitting here and I'm enjoying all the science and all, but, I know good and well, and you guys do too, what really flips everybody's switch here is the results, just what you said, Lee. And, the results we've seen, and I see daily in my clinic and personally, are just mind-boggling. That are the byproduct of all this science we're describing. For the people that aren't science geeks, I'm going through my text here. Twice in the past month or so, I've had people with wounds, these were surgical, that weren't healing. And I had one lady had a little wound on her abdomen about that deep and about that wide. And so you could see the muscle, you could see meat in there, and it had been infected and she'd been on antibiotics. And I think it had been going on for a month or two. And I told her, rub the Renew 28 gel into the wound, because it's safe to do that 5 times a day. I think it was 3 days later, she says, if I can find it, there it is. Hey, ASEA gel 5 times a day on incision, working very rapidly to heal. Gracias, doc. And, there was another one just like that. I just love these things that we see that you don't see anywhere else. You don't see in any alternative or certainly mainstream practice. And I tell people this causes that process to accelerate 5 to 10 times based on my own experience. You guys probably have seen the video where I tripped running down the mountain and knocked myself out and ripped my eyebrow loose and so forth. Had a concussion and, so forth and so on. But I had 7 stitches here and 3 here. I was 63 at the time, so 7 years ago. And I was rubbing the gel on every day and drinking the drink. In fact, I drank a whole bottle on the way into the emergency room to get the stitches, probably saved a whole lot of brain cells. But in 2 weeks, you almost couldn't see where the incisions were. They were barely pink. I had a friend who said, I heard you had a bad accident. I said, I did. And she says, what happened? And I said, and she had to get really close to see. So all of that's by way of saying, the science is great and it's there. And Dr. Hayes and Dr. Osler and I can talk about it all day, but the proof is really in the pudding. This stuff makes miracles happen.
I agree. My own father had surgery on his face. He had one of those things, on his nose that they cut out and they did a flap over, and it looked like, Dr. Frankenstein had sewn it up. I mean, it just was horrible. I was like, oh, on his face. I was like, Dad, they have plastic surgeons for stuff like that. But I had him use the Renew, and it is amazing. Even at his age, I think at the time that he had that done, he's 90 now, so he was probably about 85 or so, healed up beautifully. You cannot see it. You cannot even tell. Yeah, it's just incredible how it enhances healing. And forgive me, I have all sorts of people texting me information on different stuff. And there is one doctor who's fairly well known, people probably know his name if I said it, who says that it increases our mitochondria by 30% and literally takes 30 years off your life. Taking these products actually starts turning back the hands of time. So I was like, I would love to know how he tested for that,
Yeah.
he was using it in his practice. So I don't know if he was doing biopsies or what, but
Right.
she said she would find out for me. So, that would be fascinating. Because there's a lot of people, who including Donaldin Dominguez, who is on the medical board with us, who's also texting me, who has done some kind of kept metrics. I wouldn't exactly say there were clinical studies, but, kept detailed notes on what people were experiencing while on the products. And of course, she's a midwife, and so she was working with a lot of pregnant girls. And, so we have a lot of practitioners. That's one of the things that is so interesting about this. And one of the things I want to talk about is how many practitioners, once they realize what we have our hands on here, and that this is the only place that you can get it, they use it and they incorporate it into their practices. And, there's a lot of them that have different research that they've done themselves that we need to kind of bring that all together and see where we can go with it. Because, like you said, we see amazing things every day.
Right.
So, do you want to talk about that?
I was just thinking about, we were talking about wound healing and so forth, as well as, independent research or our individual research and so forth. I think I see in my practice, so many things. It's not just wound healing and so forth. I remember the medical atomic physicist who stabilized these molecules, Dr. Samuelson. People would ask him, well, will it help with this, that, or the other disease? And he would say, well, does what you're talking about involve a cell? And so the reality is the panoply of the amazing scope of what we see is that anything that involves a cell is going to get better. So, it doesn't matter what it is, we're seeing amazing results. I kind of, as a generalization, when people, ask me that, well, how is it going to help with that? I say, well, and it depends on dose and so forth and other factors. But if you were 20 years younger, how would your body deal with this? So, to broaden the scope a little bit.
That's a good point. And somebody is asking about some of their friends taking, I don't know if it was the cell performance or if it was the redox, but it's interesting. Not everybody feels the same thing and not everybody feels it at the same time. And sometimes you don't know because the body is directing where these molecules should go. So you might not even be aware of what it's working on. But it's interesting, our bodies are miraculous and we don't pay attention to them when they're working well. Everything's going along just fine. It's when something is amiss that you start noticing, that you have pain or things aren't functioning right. But the funny thing about that is that that's been brewing for a long time before it manifests. So you don't become sick overnight and you don't become better overnight. But, if you're not feeling anything and you're taking these molecules, they're going to do what they do. They can't help but do it. That's how they work. So it's kind of like taking vitamin D. You don't all of a sudden start shooting, sunshine out your eyes or anywhere else, but it's working the way it's meant to in your body. So it's really interesting. I know for me, it took 6 weeks before I noticed anything. I was unfortunately past the 30-day money back guarantee, or I would have probably gotten my money back. It was actually a blessing because my sponsor was like, keep drinking, and I was like, this really is salt water from Salt Lake City. And then all of a sudden it was like, the angels were singing. I was like, oh, this stuff is wonderful. Okay.
Sunshine coming from your eyes. That was good, Mark.
Yes. Oh, thank you. Good visual, huh? Yeah. So, it's hard. We're making light of this, but it's amazing. I never when I first got started on it, you read on the back, salt water and salt and water. It's like, okay, I live on an island. Don't really need a lot of salt water. But this stuff truly is, it's miraculous. Like you said, it's just the body is miraculous, I think. And
So I'd like to ask Aaron a question and follow up to what
go
you
ahead.
just said. Aaron, could you describe, to kind of follow on there, this idea, well, I don't feel it, just kind of talk about the difference between a drug and a cellular health supplement.
Yeah, good point. Just to kind of go back to the beginning where Maureen did the disclaimer, the FDA in the United States and most equivalent organizations around the world consider this as a supplement, even though it has no nutritional value. And again, really, really misunderstood. That's why we do presentations and calls like this, because people think it's like zeolites or it's like, protandiminol, and it's not. This is the only product in the world that has these molecules in it. There's not, as Alan used to say, there's not a shelf in the health food store for cell signaling products. So this is very unique, and it does things that, the things we're describing, because it's doing things that, nothing else has. I just lost the train of what you asked me. Ask me again, Lee.
So the question is, people have an expectation when they take a drug that it's going to do something and they will feel it. Therefore, they know it's working. So mash that together with what we're talking about here.
So, again, what Maureen said, Dr. Hayes said, these are native molecules, and how they interact in my body or Dr. Osler or Dr. Hayes's body is very different. And each individual is totally unique. And so what they notice and when they notice it is going to be different. Like when I first started drinking it, it took 4 months, and all of a sudden I was sleeping like I hadn't slept in 15 or 20 years. For my sister, that happened in 2 months. I had a veterinary researcher friend from Korea he started sleeping like that in 2 days. One thing after another stopped hurting in my body over a year. Some people can drink it, and within a few days that happens. I would say the generalizations that I've observed, and you guys can comment if that seems legit to you, is everybody has more energy. Everybody sleeps better. Everybody seems to be happier. They deal with stress better. and they think more clearly. When that happens is very, very individual. And a lot of it has to do with how old, how sick, how healthy, diet and so forth. Versus a drug, if you're taking something for, like, let's say, I don't know, MS, you may not feel that drug, Lee. I am impressed, what Dr. Hayes was saying. She didn't notice anything in 30 days. Sort of go back to what we're just talking about. I would say most of us who've been using this more than 5 years, I noticed improvements, new stuff for 3 to 4 years. And I would say in the last 6 years or so, every once in a while I'll experience something new, but mostly it's maintaining. So again, it's that concept that Dr. Hayes talked about. It's working. What you talked about, you went into that deep dive into the science. This is turning on our cells. It's making them work more efficiently to do whatever it is their job is. That lovely genetics study they did with Tourette Labs shows that this is improving not just intercellular, but intracellular communication between our genetic material, which is like the operating system of a cell, telling the cell you're a heart cell. So here's, how you make contractions happen, or digestive, or hair cell, or whatever it is. It tells the cell that's what its job is. So it's improving that communication. Again, back to where we were talking before, how that expresses and when, totally individual. When we know it's working. Early studies they did showed that 15 minutes after they gave this to these high performance athletes, they had gone through these remarkable metabolic changes inside the cell before they even started exercising. 15 minutes after they drank it, in all the precursors and the intermediaries to the Krebs cycle. So in other words, it was dramatically increasing energy production and utilization. They did a study in Fort Worth with Stevens and Associates that showed when you rub this Redox gel on an area, like if I put it on my wrist enough so it takes about a minute to rub in until it's dry, 15 minutes later, 49% increase in the microvascular blood flow. So, and by 4 days of just using it twice a day, even it was a persistent effect. Even before they rubbed it on the second time, it was 55% increased blood flow. Anyway, the short version is too late for the short version. The synopsis of that is that it works fast. And what I tell people, that the molecules in here are 2 and 3 and 4 atoms in size. So when you put it on your skin or you drink it, boom, it's inside your body and throughout your body almost instantly. So you don't notice it, it's working.
Hey, Maureen, would you outline the gene pathway study? Yeah, because that's really a good one, I think, to answer this idea. Well, does it work? I don't know. I didn't feel it. Is it working?
Yeah, that was an amazing study. It was somewhat of a gateway study because they were throwing out a wide net. They wanted to see exactly how this was working. So they took a group of healthy 35-year-olds was the median age. And because the IRB, the Independent Review Board, only gave them 8 weeks. We always talk to people about staying on the product for 90 days so that, all the cells that are generally turning over in your body have a chance to turn over with a full complement of these molecules. But they said 8 weeks. So they went to 8 ounces a day, which is double what is on the back of the bottle, which is the maintenance amount. 2 ounces twice a day. So what was interesting is they did a double-blind placebo-controlled crossover study. So for the control, they were using the saline that our product is actually made from. So what happened is 100% of the participants had an increase in gene transcription from 20 to 31%, which is extremely significant, and 0 on the saline product. 100% of the participants. So whether you feel it or not, it's doing what it's doing. It's increasing this transcription of these genes. And there were 5 known genes that were impacted, 5 beneficial genes that have to do with your cardiovascular health, your GI health, your immune status, inflammation in the body, and hormone modulation. And one particular gene, EGR1, is very well studied, and it has 15 known pathways. And those include things like insulin signaling, thyroid signaling, spinal cord signaling, embryo implantation, serotonin levels, circadian rhythm, and NRF2. And so when we talk about what the company is doing with research, we have new studies that just came out that we were talking about with the NRF2, showing that it's increased up to 60%, including in damaged cells, and it goes into the nucleus and increases intracellular glutathione by up to 40%. That's one of the pathways on one of the genes. So Dr. Kaufman talked about Protandim, which is a great product, talks about it indirectly increases NRF2 pathways. Great product. That's one key that we're pressing on all of these. We have 15 on the EGR1. We have all these other genes to study. So absolutely amazing. So, it reminds me, I read a book. I'm trying to remember what the name of it was, but it was by Dr. Stephen Gundry. You guys probably see him on TV. He's always talking about what to eat and what not to eat. And he wrote this book, and it talked about your genes, and it talked about killer genes, and it talked about, lifestyle. We think about our genes. Most people, when they think of genes, they're thinking of the color of your hair, the color of your eyes, what you got from your mom, what you got from your dad. But there's a whole field of study called epigenetics, where you can turn on genes or turn off genes. And that's what we're talking about here. So when you're using these products, they're turning off the killer genes, the ones that are going to take you out. If you really want to scare yourself, read the book. I was like, oh my gosh. So it's like, if you're sedentary, your body's going to start shutting down. If you're not living a productive life, because think about it, from a genetic standpoint, you are in direct competition with your offspring for resources. So if you're not producing, if you are not active, if you are not contributing, then your cells are going to start turning off. And that's why we start to see older people have more diseases, because of all of these things that are happening in the body and that are accelerated by a sedentary lifestyle. So we've got something that is turning on beneficial genes. Doesn't everybody want that? I mean, that's amazing to me.
I think, Maureen, is a salient sort of concept for people who are listening. In the past, up until epigenetics became a thing within the past 10 years and much more so recently, people said, oh, I've got the genes for blah, blah, blah. And a lot of people still feel this way. And it's almost like they're condemned. I'm going to have this condition. And the lovely thing about epigenetics, and man, talking about playing the keys of the piano, ASEA and the Redox products really turn on our epigenetics in a positive direction. It says, no, just because you have that gene, here's all these things you can do, you exercise and diet and blah, 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 blah. But particularly supplementing your redox molecules, they can definitely swing that pendulum or arrow in the opposite direction. You don't have to be a victim of your genes anymore.
I love that. You don't have to be a victim. And isn't it Anne Louise Gittleman who says your DNA is not your destiny?
That's good. Yeah.
Yeah. Yeah, it was good. I should have stolen it, but Anne Louise Gittleman said it.
I want to go back to one more thing about the Tourette study. I don't know if you guys experienced this. I bet you did. I would share this, and it's probably not compliant, so I'll try to control myself. But, here they studied these 5 genes, the ones for, downregulating inflammation, upregulating normal immunity, which is mind-boggling. It's both ends of the immune spectrum, and it's creating, homeostasis and then some. And the digestive enzymes and, cardiovascular elasticity. Oh my gosh, so important. What did I leave off?
Hormone modulation.
Hormone modulation, hormone balance, and so forth. So I looked at that, and particularly when I looked at those 15 subpathways of the EGR1, I'm sitting there going, they studied 5 genes. and it had this positive effect. I'm going, there's no way this is not positively affecting all 40,000 of our genes. And so it
Our bacteria's genes too, probably the microbiome.
Yes, yes. So it harkens back to this is why it deals with it, it enhances our body's ability to cope with everything.
Well, for the science and the redox geeks out there, this whole thing is it's called the redoxome. We talk about the genome and the metabolome and the proteome and the transcriptome. Well, the epigenome or redoxome, the overlay, that's what epi means. It's epidermis is the overlay. So the epigenome is the environmental overlay or influence on the genome. And so this whole point of the hundreds, thousands, tens of thousands of switches that are controlled by this redox sensitive landscape, that's what we're talking about here. That's why, we again, in the drug mindset, we have, and in conventional healthcare, we have a reductionist thinking where it's a one-to-one relationship. But nature doesn't work that way. Nature works in a pleiotropic way where one thing can affect many. And so, and that's an important concept because this is a landscape. We call it the redox landscape because of the thousands and thousands of redox sensitive switches that we can turn on or manipulate through lifestyle and through redox supplementing.
Someone put, I was just going to say, Marcus put in the chat a disclaimer. We actually gave that already, Marcus, but just in case, because we are getting into a bunch of different stuff. Again, this is not a medical product. We're not a medical company. Even though we're medical professionals, this product is not meant to cure, treat, prevent anything. It's just going to make your cells do their job better. But when your cells do their job, miraculous things happen. So thank you, Marcus. So anyway, this is so much fun. You can tell that we get together and geek out, and it's even more fun when we have the whole medical board. And, one of the things that we were chit-chatting about before we got on this call was not just some of the research that's being done, but by the universities, but the research that's being done on site. Our guys are constantly studying these products and improving them. And for those of you who are coming to convention, I hope everybody who's listening to us tonight is coming. You can actually tour the production facility. And if you've never been there, or if it's been a while since you have, please take a tour because it will just blow your mind. I think I was there 6 or 8 times last year. It seemed like I was going every month. And even, every time I would tour it, something was different. So absolutely amazing. Even what they're doing with the stability of the product and the concentration of the product and things like that. So,
I think before we run out of time, I want to touch on what I mentioned before. This last medical professionals board meeting was so exciting, and it just reflects to me the level of inclusion of us as practitioners, physicians, and so forth. The new research, the university research, their openness to internal research, oh my gosh, the reformulation of the products is so exciting. New redox products that are on the way. It's like, it was such an exciting meeting. And, at the end, sort of, part and parcel and a reflection of that is the fact that they hired Hunter Dean, who's just mind-bogglingly brilliant and competent and just understands everything and has this tremendous ability to work within all these different areas and communicates well and works with people well. And Dr. Borges is brilliant, and she's fielding all these things and asking us for input, and we're making suggestions. I've sent her a bunch of things over the past couple of weeks about formulations for products I use in my clinic, and she's going to be researching some of those products. This, to me, reflects such an exciting phase in this company. It's a new phase where there's more openness, more expansion, and
Collaborative. Yeah.
yeah, I'm so thrilled. I told people at the meeting, ASEA's, mission to be a force for, or to better people's lives and be a force for good. I was overwhelmed at the end of that meeting, and I voiced that, and I said, this demonstrates that. So for people who are listening for the first time, or you've been around forever, oh my gosh, the right place at the right time. Amazing things are coming and are already here.
That's fantastic. Yeah, it's very, very exciting to be a part of this, and I think a lot of people, and maybe we can talk about the bone that is always stuck in Dr. Lee's throat. People sometimes shy away from network marketing. And I know I was speaking to someone recently and they said, "Is this a network marketing company?" And I said, "Our marketing and distribution arm is network marketing. But really, at our heart and soul, we are a research and development company. We are a biotech company who happens to use this. And thank God. I mean, what an opportunity for people to have something this incredible that you get to be a part of, and you get to be kind of an owner in the company, because I've never worked with a company that had such integrity and cared so much for the people who are involved with them. I mean, it's palpable. Their respect and their love for the field is palpable when you're with them. So yeah, I can't say enough about it. It's best move I ever did. I almost missed it. When I think back to, just thinking it sounded ridiculous. I didn't want to tell people. I didn't want to admit that I was drinking salt water, and until I started seeing things happen. And then I was like, what in the world?
Yeah.
So
I was a big time medical skeptic, was tremendously averse from bad experiences in the 80s and 90s to, marketing this way. And, you know, divine orchestration, whatever you want to call it. The early studies, when Virtus first came across this technology and, wanted to start doing research, and his son-in-law was a high performance cyclist, and he's drinking it and having all these amazing results. So that was what led them to go to Neiman and do all this athletic research, and perfect orchestration for me, who was, 46 years a runner and mountain trail runner and so forth. And I read all this, and it's really well done research. Yes, it's independent, but like you say, they have independent review boards. It's double-blind, placebo-controlled, and some randomized, all that kind of stuff. And I'm reading it, and it's exactly what I have going on. And so I start having these amazing results, like within the first month. And I commonly will say to people, it's not uncommon for athletes to notice this sooner than anybody else because of that, particularly if they measure parameters. And, once I started drinking it and sharing it with patients, it was just off to the races. But I went through the succession. The first thing was having these amazing results in myself. And then starting to see it, and my purpose in life is like ASEA's mission, to help my patients, to help people, to be of service. And I'm watching all these things happen that are just mind-boggling. And then they start sending me money for doing that. And it's like, wow, and what you just said, Maureen, then I met the people at ASEA and I just fell in love. It's like, I used to say, I want to spend, my goal is to spend the rest of my life hanging out with these people. And guess what? I'm doing it. I'm still doing it. I said, I feel like I've hit the jackpot. And, so if people feel aligned with that, you're in the right place.
The interesting thing there is I was thinking, because we've all had, or many of us have had experiences, in other places, and you wind up having to overstate or hype or kind of guard yourself. But that's one of the refreshing things about ASEA and ASEA Global and the products that we have, is that they're so groundbreaking, they're so foundational, they're so upstream, they're so correct, that you don't have to overspeak them, and you don't have to overreach people. You don't have to jump up and down and create a bigger buzz than you need to convey it. So Aaron, tell us, in your opinion, where's this going? What is this whole field looking like, and what's the future?
So you're being Jim Glenn tonight, huh?
Yeah.
He is.
Well, I kind of already said it, Lee. It's like, it's like, what is it? Maybe, I don't know, 100,000 plus people who are using these products. And, if we're lucky in the United States, maybe 2% of people have even heard of this. And, what I say is there's 7 billion plus people on the planet. And like Dr. Samuelson used to say, they all have cells. Everybody on the planet needs these molecules. They have bodies that have cells, and they need to turn on the efficiency of those cells, whether they're healthy or not, whether they're an athlete or not, just because they're alive. So, oh my gosh, it's that old analogy of we haven't scratched the scratch. So, and I love that Tyler and the administration of this company have the goal, have the desire, and are taking all due diligence, and have for close to 15 years, to make this a legacy company. It's not designed to be here and gone like so many companies, to make a buck, and this, like, then they crash and so forth. We're almost 15 years. That's an amazing thing. So not only is the sky the limit, we're fast going there. We're in that hockey stick phase, I believe.
I think so. We're just at the tip of the iceberg, and we don't even know what we don't know,
Yeah.
The more they study it, the more things come up, and we're like, wow, who
Mhm.
knew? So we're gonna get there. It's gonna be fun. It's gonna be a fun time of discovery. So how is he not somebody's just texting me, how is he not on our team? I was like, well, somebody else got Dr. Kaufman to join, one of our docs. So that was fantastic. Hey, Aaron, this was wonderful. As always, you have just such a great way of kind of bringing this down and making it so just understandable. You're deep into the science, you've got a great understanding, great fund of knowledge, but you can still relate that information in such a great way. So really, really appreciate that. And of course, yeah, absolutely. Love having you. I know why you're a fan favorite. And of course, Doc over here he just exudes brilliance. And then, I like to think I'm eye candy, but oh, thanks. Thanks, guys. Anyway, this was so much fun. Thank you for thank you for coming on. Thank you for leading us, Dr. Lee. One day I will learn how to do the controls so I can help out.
Well, this has been fabulous. I really have high respect for Dr. Aaron, and he's getting to be an old man now, but his cells are. I think we're probably pulling equally on the harness there. But anyway, it's nice to have some strategy. I was thinking earlier as you was talking, think a century or 2 centuries ago, when all the big thing going on was looking for the fountain of youth. And over the last, I don't know, 50 years, every company out there that with a skin cream or a vitamin or, a diet, or it's like they're always focused on, be younger, feel younger. And I'm not, we're not throwing anybody under the bus, with that, but there is a right way to do it, and that is to get your cells talking. And to not do it with like a pharmaceutical type suppression of, aches and discomforts. And so, that's what this is about, and that's why it works so well. So thank you, Aaron, for being on with us and representing the great state of New Mexico.
What a great honor, what divine grace that we get, not just to do this call, but that we have this opportunity and we get to play in this field and understand so much as well as benefit from it and help others. What a gift.
And make such great friendships,
Yeah.
you know?
Does that
Absolutely.
answer your question?
It's a fun sandbox that we play in, and so I would just encourage everybody out there who's
Long been an acquaintance.
listening or who would watch this on replay. Talk with the person who invited you. There's as Maureen said, there's only one place to get this, and that is through a referral from somebody who's kind of already in with the company. So however you want to participate with this, check it out, do your due diligence, but most of all, get some and just try it. There's money back, there's zero risk, it's zero toxicity. What you want is young cells talking to each other. So
Exactly. And like Jim Glenn will say, don't get it on Amazon because you don't know what you're getting. Could be expired, could be bootleg. And I'm sorry, I don't know if you guys have I'm talking about friendships. My refrigerator got in on the act one day. He's like Chat GPT over there defining friendship. I was like, that's so weird. But in any case, who do you have next week? I'm actually going to be at a conference, so I'm going to miss it. But I think it's Dr. Martin.
Dr. Morin.
Yeah, he's all.
Yeah.
we have our veterinary friends coming on to tell us about that. This isn't just isn't just for us as a species. So although it is marketed for humans, and again, we make the disclaimer, this doesn't heal, treat, cure, or deal with disease. It's a cellular health supplement. So thank you.
It's perfect. Marty can comment on, this is how you teach your dog to heal.
Like they need to be taught, right? There's no placebo there. So we look forward to having him on with us next week.
Yeah, he's always good. So I'll miss you guys, and I'll miss you guys out there. And thank you for all the compliments. So sweet. Just love this group. Love doing this call. Anyway, y'all have a fabulous weekend, a fabulous week, and we will see you. You guys will see them next week. I'll see you in a couple of weeks. So thanks again, Aaron. It was wonderful. Thanks, Lee.
Bye-bye,
Bye, everybody.
Love you guys.